Working in healthcare, I would say, it's been phenomenal for me. And why did I even choose to come into healthcare in the first place? Because I love humanity. I love giving life back to people. It's not like I love to see people being sick, but when you see people that are sick, that means they need help. So giving the help to them gives me a lot of great joy. So that was the main reason why I decided to be a nurse in the first place. So I did my training back in 2002 up to 2005, and I became a theatre nurse. I did a couple of months in a gynecology ward, and then I so much loved the closeness, the unity, the how we work together in theatre environment. So I decided to further my career in the theatre. They call it perioperative journey. But a lot of, in a layman term, it's called theatre. But in our terms, it's perioperative. So I further my education into perioperative, which is in theatre environment. I did my training in King's College University in London. I chose King's College University because that particular year they were on top of the league of the best uni in doing nursing. They were on top that year. So that's why I chose to go to King's College. Getting into King's College was very tough because they're a very good university. They don't take their work lightly. They train their students to become a very high standard student. I'm talking because by the time I graduated, or few months into my graduation, I already got 3 jobs lined up for me, just because I trained at King's College University. It is a very good uni. That is why I chose to go there. Training there, most of my training was done in Guy's and St. Thomas's Hospital, which is in the heart of London. I have seen a lot of, I can't mention name, a lot of the ministers, celebrities, name them. So training there is kind of bring this closeness. That's where I developed my love for theatre because of the closeness, how we work together in theatre. So I finished the training in 2005 and I became a theatre practitioner. So now I've been working in theatre environment since then up till today. Training in King's College University, it's a kind of, I wouldn't want to go too much into the racism part of it. It is very tough uni to go into the first place anyway. Then my skin color, that become another issue. So going into there, you know you're going into a tough environment. So I'm a kind of strong person, so you have to toughen yourself up to say, I know the world I'm going into. Nursing is a very, very challenging environment to work in. Then you work with doctors. They call us the multidisciplinary team. The doctor, the pharmacy, the healthcare assistant. It's quite a lot of us that work together. So you have to develop a very tough skin to going into King's College the first place, and then training in the heart of London. You know, racism, we can't sweep it aside. It's there. It's glaring in the eyes of everybody. But being a black young woman, I trained myself to say, it is a tough world, so it's either you go in there and win, or you go in and lose. So that has been good for me to finish my training there. When they come up with a fight, you don't fight back. If you want to fight back, there is an adage we always use in my country, you choose your fight. If it is a fight that is justifiable, yes, you pursue that fight and fight it properly. But if it's just a fight that you know you're not going to win, you don't go near that fight. So I choose my fight during all my training. There is a particular one I can remember very well. I was placed on a placement in a CCU ward. It's all white people there, to say. So I'm the only black girl there on that particular ward. The rest of my colleagues, the rest of the students, they're all white. The nurses are white. So every morning when we arrive on shift, there is something we have to do because it's a CCU coronary care unit. you have to do something called ECG, electrocardiogram, for all the patient because they have heart condition, just to know that there's no issue going on with them at that particular day. So there is this particular nurse, she's always on my case. When I ask you to calculate drug for me, you don't know anything, you're so useless, you're so... She wouldn't use the word you're a black girl. She'd say, people like you. She kept using that particular word, people like you. And then I just had to take it up to my link lecturer to say, I don't understand the meaning of people like you. If I've got a name, everybody, as a nurse, you all have a name tag. My name is Roseline. Please refer to me as Roseline. Don't keep saying people like her, people like you. What does that mean? So I took it up with the university and they dealt with the nurse. They wanted me to repeat that particular placement, but my link lecturer said, no, our student, we train them to a high standard. I know what Roseline is capable of doing. You know, going into placement area and studying doing the theory at the same time can be very challenging. So we come in to learn. There is something we do once we qualify, we call it mentoring. If you don't create an environment for the student to make them have a positive outcome in their learning, if you're making everything negative, of course they're going to be scared. You ask them a question, you're going to throw them off balance. So my link lecturer sat her down and explained to her that this is a learning environment for the student. You have to facilitate a good learning environment. Don't throw, these are our future nurses. You can't scare them off. I'm an old nurse. I've become a lecturer. God forbid if I take in Hill today, if you don't try and transfer your proper skills to this student nurse, what they're going to become tomorrow. So you have to facilitate a good learning environment for the student. And then she sort of took everything on board and said, you're not going to repeat that placement. We're going to pass you. And that's how I won the case. When I qualified, my first job was on gynecology ward. So I did that for 6 months. But for the love that I have for theatre, I sort of have at the back of my mind that when I finish my training, I'm going straight into theatre. But at that time, they wouldn't take anybody because theatre is such a, it's a highly specialized area. You have to be qualified, practice, they call it consolidation. You have to consolidate at least 5 months or 6 months before you come into theatre environment. So that's exactly what I did. Got a job in gynecology ward and then did 6 months there, then got another job in the same hospital as a theatre practitioner. I took a patient from my gynecology ward to a theatre. And the sister of that theatre, I went with a white girl. Sorry, my language, white girl. I went with a white girl. She's a student. She was my student. I was the nurse. So she saw two of us and she turned around and started talking to the white girl. She thought I was a student because I'm a black nurse. And then she's asking a question. And when they finished, the student just turned around and looked at me. I said, yeah, you can answer her. She's talking to you. She's decided to overlook me because I'm a black nurse. And then she turned around and said, I like you. That's the manager now. She said, I like your courage. A lot of people don't stand up to me. I said, why do you just assume because I'm black or because I look young? You know, when you qualified as a nurse, you're 19, 20. Look young, black nurse. They're well-to-do, not well-to-do people, black people. So she said, okay, I'm sorry, I didn't mean to do that. So how are you the nurse? I said, yes, I am the nurse. I've come to collect my patient. And then you turn around chatting to the student nurse just because she's white, like yourself. She said, oh, I'm really sorry. There is a job going on. Would you like to apply for the job? And I said, I just gave her a big hug. I said, yes, that's my big dream. I've been wanting to be a theatre practitioner. Please, I will take the job. She said, oh, that's fine. It's a sweet transition because you're in the trust already. I'm going to speak to your manager right now. So you just go, just prepare your mind that you're coming to work in theatre for me. And I said, oh, thank you. You know, these people, they're managers, NHS manager, they're not, I don't want to say too much. NHS manager, they're quite diplomatic people, the way they deal with black people and white people. So it's like we're in two different worlds. Meanwhile, we do the same job. For example, if there's a post, a band 6 post or a band 7 post coming up, they'll rather give it to the white nurse than to give it to a black nurse just because they see us as we're second best. We are not second best. There's a lot of us, we've educated ourselves to the degree level, master level, better than some of the nurses that are white. But they wouldn't see that. They rather see you as the black nurse, not the person that carry all these attributes, all these qualifications, all these how to relate to patient, how to care for patient. They rather give it to the white nurse just because they're together. I've been a theatre nurse for the past 16, 15 years now. Since 2005 to 2021, I've been working as a theatre practitioner. We're theatre nurse, but they call us theatre practitioner in the theatre environment because it's the easy title to call us. So I have been working as a theatre practitioner for quite a number of years. And during the pandemic, it became so challenging for us as a theatre practitioner because a lot of us were deployed to ITU, which is an unknown familiar area for us. Though the kind of job we do is a bit similar. But when you work with people that are intubated, there is ITU and HDU. A lot of people always mix the two together. There's ITU and HDU. So ITU is intensive care unit. HDU is high dependency unit. So ITU is where people they can't do anything for themselves. You intubate them, we totally take over the care for them. They'll have tube with them, they have catheter, they have CVP, they have arterial line. So you're basically giving them life. HDU are people that are okay. Maybe they've undergone some major surgery that they need more close observation. So they take them to HDU just to get better before they discharge to the ward. Wow. When COVID first started, it was very, very daunting moment for all of us, including Boris Johnson himself. Everybody didn't know what to do. We were in panic mode. The theatre environment, hospital environment, we were not well equipped to deal with the crisis because it's like the crisis sort of came suddenly and it overtook the resources we have as an NHS worker or as a caregiver. So during this period, we as the caregiver, we sort of all came together to say what is the best way forward to approach this pandemic. People were coming into hospital. It got to a point that they have to choose who we really give care to. We have something we call ASA 1 or 2 or 3. They call comorbidity. So if they bring someone that is 50 years old with lots of comorbidity, or somebody that is 25, 20 years old with less comorbidity, they rather give care to the younger person than to give care to the 50-year-old with comorbidity. That became an issue. That why have you chosen not to treat my mom or my dad, and you've decided to treat this young person? It became a big, really, really big issue for the ITU consultants and for us that are working with them. But we have to do it because the COVID-19 was like it was more than us, outnumber us in the hospital. So we have to adapt the theatre, the recovery space. Every theatre became an ITU space to look after COVID patients. PPE became an issue. It got to a point that somebody one day said something to me that I just took off all my PPE. I said, I don't care if I catch COVID. She said to me, oh, they've asked us to reuse our PPE, and we said no. And then she turned around to me and said, well, you're only an agency nurse, so you should be able to reuse your PPE. If we, the permanent staff, are reusing our PPE, I said, well, that's you. But as for me, you just made a statement, say I'm an agency nurse. Agency nurse means when I don't work, I don't get paid. I'm a freelance. You're an NHS worker. If you go off sick, the hospital look after you. So for you to make that huge statement, I think is quite not fair. So I took it up to the management, which they did. They stood by me and said, no, you shouldn't have said that. And they had a big meeting with all the staff. Agency or permanent, everybody is NHS worker. The way I always see myself, any hospital I go, I said, this is NHS. Hey, this is my home. I'm a trained nurse. So any hospital I've managed to find myself, I'm an NHS worker. I don't see myself as a permanent or your agency worker. We are working to achieve the same goal for this patient. So it doesn't matter if you're agency or if you're permanent, we're working to achieve the same goal. So they sort of dealt with that in a very subtle way to say, I know you're an agency staff, but we stick with you. To say it's not nice thing to say. Reusing PPE wasn't acceptable because we don't know what has stuck to the outside of that PPE. You want me to reuse my mask? I've been touching patients with COVID. I've been touching my mask. And you want me to go on break, hang the mask somewhere, and the PPE somewhere, come back and put it back on again. So we all said, no, we're not going to reuse our PPE. And it became a national issue that even the health minister have to appeal to everybody on TV to say, please, whatever you have, help us manage it. It was very, very challenging. And then finishing in theatre, because I'm an agency nurse, the work sort of dried up. There was no work. It became a big issue. So because I'm quite flexible, so I redeployed myself to A&E in another hospital up north. That became a big, big, big challenge. In A&E, they divide the A&E into different sections. They said the red area and the green area. All the black nurses were always allocated in the red area. Meanwhile, the government are shouting that the BMA, the BIMS people, we are the people that the COVID are affecting more. It affects us more than the white people. Yet, we go in there every night, every day. They prefer to allocate us into that area. And you're not, the mask, they call it, there's the FFP3 and the normal mask. The matron will tell you you're not allowed to wear the FFP3 mask. You have to wear the normal mask. The reason why the FFP3 mask is there is to prevent you catching COVID from these people. So why are you saying we shouldn't wear it? So one night I had a big argument with the matron. I said, I understand I'm an agency nurse, but that doesn't mean you should be treating us, you should be, how do I put it in English? You should be treating us differently. We are human beings. It doesn't matter where you come from. You're black, you're white. If you bring a white patient in front of me, do I discriminate? I don't. I give everybody the same treatment according to their illnesses. So why should you discriminate against us because we are black nurses looking for our daily bread? Everybody's looking for their daily bread. Most nurses, most agency nurses during the pandemic, they decided to stay at home not to work. But I said, no. If all of us decide to stay at home, these people will die. How many people is going to be left in England? We need to stand up. Some of us need to take that bold step to say, COVID or not COVID, I am going to fight for these people. Because once you sign your life, you want to become a nurse or a doctor, you sign to look after the people that are sick. So COVID or no COVID, I don't care. I see them as a sick person. I don't see my patient and see COVID in them. I see somebody that need my help. So I'm not going to sit at home and let these people die. So the matron said, oh, well, the PPE is there for you to wear, but you have to choose carefully which one you pick. So I said, we are not choosing carefully. We are choosing the one the government has approved for us to wear as a black ethnic minority. You're not going to discriminate against us. Don't forget earlier I said you choose your fight wisely. When you speak to these people, they always tag us that black people shout. We don't shout. That's the way we're brought up. We're not aggressive. We talk with our hands. We like to use hand gesture, our face, because when the argument is very intense, you go into some funny African mood. That is us. So thank God some of them are beginning to understand that that is us. You can't change who we are. Between all of us, there are some black nurses, they don't like to talk. I'm not one of them. I like to talk. I like to ping things out to say, this is wrong, this is right. Whatever you think needs to be fixed, you fixed it. Don't discriminate and say because she's black, so I'm not going to fix her. No, I'm black, you're white, you fix both of us together. So a lot of the agency nurses, we're all black. They come into work, they see another black nurse, say, why they decide to put us here? Then speak. Don't keep quiet. Because if you don't speak, they say, speak louder so they can hear you. If you don't speak louder, they're not going to hear you. They're going to be thinking, oh, she's fine, he's all right, they can do it, she can do it. No, we can't. We are scared. Even though we are putting our life on the line for this patient, for your mom, for your dad, for your relative, we too, we go home to a dad, to a husband, to a child, to a relative. So they have to put us into that consideration as well, that these people, they're looking after sick people, not just sick people, COVID, not just COVID, deadly virus. Viral that'll catch you, you can die anytime. So we're sticking our neck out for these people. So I said to them, please, we black nurses, we like to refer to ourselves, my sister. When we see at work, oh, my sister, you're here today. Please, sister, speak up. Being white, being black, that doesn't make you a less of a human being. As a black person, as a white person, we all share the same blood. We all share the same breathing air. We all have the same, we might come from different background, but we're all the same. So if you know you don't like where you've been allocated as in a red zone, please speak up. Speak to whoever that's in charge and said, okay, I've been here today because I used to do 4 nights. So in the end, what they decide to do, if you're doing 5 nights or you're doing 4 nights or 5 days, they put you 3 days in the red zone and the other 2 days you go to the green zone. So that's how they decide to split it in the end when all of us decide to speak up. The matrons, the people that don't come to do the work, we are the one at the forefront doing the work. They sit in the office, ticking papers, ticking attendance, but they push you to go and work, but they're not going to give you. It's like sending somebody to school without a paper or without the pen. How is the person going to learn? So you're pushing us to go and look after these sick people. You need to protect me, give me the right equipment to look after the sick. So basically that's what we did, and they listened to us and they changed. Meanwhile, some people stopped coming because they couldn't speak up. I said, I've got a family to feed, you provide me with what I need, and then I do your work for you. Going to work every day is always like you have this panic attack in you. You have this, your body feels hot right from inside because it's like a battle zone. Every day comes with a different challenge. You don't know what you're going to face today. Don't forget, this patient, they come in with COVID. Then some of them or most of them have other comorbidities. When I refer to comorbidities, for example, someone that has asthma, someone that is diabetic, someone that is obese. So they come in, you put them on a hospital bed. For example, someone that is obese, you will have to turn them. We roll them into a log. We turn them every 2 hours. So you can imagine someone that is a 10 stone going to roll someone that is 110 kilo. It's a big challenge. Plus, when you're rolling them, you're disconnecting everything. They're breathing, puffing everything at you. Those are the particles they talk about because COVID is airborne. You disconnect everything, the fluid, body fluid, disconnect everything, they all come back at you. So going to work is always a challenge for me. But I always said, I believe in God. I know God will go with me and he will come back home with me. One thing that has always really make me scared, I've got an 8-year-old boy at home. Each time I come back home, he run towards me, want to collect my bag, want to kiss mommy, want to hug mommy. So I have to hide when I get back home because you don't want to say, you can't hug mommy. So you have to, instead of coming through the front door, I come in through the back door. From my back door, I undress myself, then run to the shower before I allow my son to see me. That I find quite very challenging. And then the next thing I'll ask you, oh, mommy, what part of the body did you fix today? Who did you treat today? What did you do at work today? You can't say, actually, I lost about 6 people today. You can't say that to them. You just have to lie. Oh, everybody is fine. Meanwhile, you're not fine. You're thinking about that somebody's father. You think you could have saved, you could have done this for that you couldn't do it because the resources weren't there. Then you come home and lie to your child, oh yeah, I'm fine, I'm okay, but you're not fine. You're not fine. Yeah, COVID time was a very challenging time for us as a nurse, as a doctor, as a healthcare giver. COVID is a deadly, deadly, deadly virus. It's a virus that you don't want your worst enemy to have. Because having the jab myself and the pain I went through with the jab, and I said, no, you don't wish your worst enemy to have COVID. I said, this is a vaccine they've given me, and it's making me feel like this. So you can imagine people that have the actual COVID. Because a lot of people say, oh, it's been overrated. The media, they're worshipping the COVID. COVID doesn't kill people. It does kill. Big time. It kills people instantly. There is a particular patient I looked after just in the second wave. The husband came into hospital to have a major operation and developed COVID from us. He did ask, can I go home? I have a wife at home. And they said, yes, fine, you can go home. He went home and passed COVID to the wife. He survived his own operation. He survived his own COVID. He didn't have any symptom, actually. Went home. And on this particular day, I went to work and they said, Roseline, you're looking after so bed number. I said, fine, but she's not good. She's not going to make it. You can imagine they're telling you you're going to look after a life, but she's not going to make it. You just feel broken yourself. But at the same time, you have to be strong for these people. We can't cry. Although sometimes we do cry. You cry, it's not because they're dying, it's because they're dying and dying alone. You become their relative, you become their mom, you become their husband, you become their dad. Some of them, you read Bible to them as per instruction given by the family. You read Bible, you read Quran, you become a hairdresser, have done a lot of makeup in ITU, do their hair, make them feel like a normal human being. Anyway, this particular patient, the husband was there. And then he said, Rosie, do you think my wife will make it? What do I say? I can't lie. Or you can say, I'm not sure. It depends on how your wife responds to the treatment we're giving her. And this treatment we're giving, once you're not, we give 100% oxygen. I'm breathing, you're breathing. We're breathing 100% oxygen, 21% oxygen. But whatever they put the monitoring on our finger, your oxygen saturation should be 100%. If it's not 100%, then we start to titrate oxygen for you from 21%, 30%, 40%. It goes up, till it goes to 100. Once we give you 100% oxygen and your oxygen saturation is still 60, is still 50, I'm sorry, your lungs is gone. So that's exactly what was happening to that patient. Close to around lunchtime, we have to phone different people to say we have to switch off everything. So once they switch off everything, that's it. They just gradually go. And you can't leave them to go alone. You have to be there. They go in front of you. It's quite challenging. So there's this particular, he's a pastor. And every day we have to read a particular psalm to the pastor. And there's the Bible the wife brought for us to read every day before he goes to bed. They keep hoping and believing he'll come back to life. Because this patient, they come through A&E. I remember that particular gentleman, before he went out to sleep, once we see that your lung capacity is not coping with what we're giving, we intubate you and let us do the work for you while you recover. The first question he asked, he said, nurse, he looked up, looked at the doctor and said, please don't let me die. When someone said that to you kind of, it has this mental effect on you because you know they're not going to make it. They're not going to come back because we're giving you 100% oxygen, your lungs capacity is giving us 60%, 50% back. There's no miracle is going to happen. So all we have to say, I know, you're going to be fine. Let's do what we have to do and see how things go. So that's exactly what we said to this particular gentleman. And the family kept ringing and ringing. Every day we have a phone, like an iPhone, an iPad we use to communicate with the family. So every morning we have to use the iPad to show the husband lying with intubated. It's not a very good sight to see as a family. Then she'll just start singing from the other end, singing Jesus song. And for all that are believers, when I hear anybody sing Jesus song that is pertaining to death, oh my goodness, the whole place just busted into, all of us just started crying. And the gentleman was dying. So we have to hold the iPad with all the family, about 10 or 50 of them in the room. They were all singing, praising God, that we know you're going to accept him into your hands. He's going. Meanwhile, he's dying. So they all started singing. All of us started crying. The whole place became, oh my God, what's happening here? But we can laugh now because we've been through it all. We've seen it. Everything is kind of over. That's why we can laugh now. But then, you can't laugh. You can't even eat. Because you wake up every day, your body is shaking because you're thinking, oh my God, I'm going back there again. Because you're thinking you're going back there again, you don't know if you're going to contact COVID to come home. That's the fear. How many lives am I going to lose today? How many lies am I going to tell today? How many people am I going to ring? How many family am I going to make cry today? Those are the things that keep ringing bell into in your head. But in all of this, as a nurse, as a doctor, you remain strong. You don't let go. Because if you let go, we all die. Somebody has to be there. The doctors have to be there. The nurses have to be there. To say, even though we're losing some, hi guys, there are some people that are making it. There are people that we intubate, couple of days, 10 days, 14 days, they come back to life. When we see those success stories, it makes us very happy. It's not that we forget about the life we've lost, but at least in out of 10, 7, 6, they're coming back to life. It makes us happy as well that, okay, whatever we're doing is working at the same time. Even though we're losing some life, we're giving them, trying to give them life back, it's not working, but there are some hope. So we have to be strong. So thanks to all the people, everybody, they sort of rally around all the nurses and doctors. They always give us food, drink, just name it all. Something to cushion your feet because we stand all day. The reason why we stand all day, you don't want to put on the PPE. There's shortage of PPE. So you don't want to put on PPE and keep going for break. You can't even go to loo break because you have to come back, discard that PPE and put on another one. There is a shortage. So having break, having loo break is a challenge for us. Big challenge. But here we are today. We can all sit down, and the nurses and the doctors and everybody that help us to stand to fight, we can pat ourselves on the back and say, you did it. Yep. We're asking Boris Johnson to give us money. Not the clapping. Sorry. I'm speaking for all the nurses now. We want Boris Johnson to give us money. Because I know it's good they're clapping for us, but where is the clap now? It's gone. But if he has given us money, we'll have used the money to do something, to go on holiday, to put a smile on our family faces, to say, because that time everybody kept bringing me from Nigeria, from America, from everywhere. They just want to hear that, Roseline, you're still there. Don't forget we're praying for you. Then you can send a card to say, thank you very much for staying by me, for praying for me, for making me feel like I'm not alone. Because at that time, all the other jobs were stopped working. Everybody was stopped working, but nurses and doctors, can we stop working? No. So it was our relative, it was our friend that made us feel that we're not alone. We are all in this together. I know you are the forefront, fighting the battle, but we're here supporting you with our prayer and calls and sending gifts, sending all sorts. So Boris Johnson, our lovely Prime Minister, I know he contacted the virus as well, but it was one of our success stories. He pulled through. Thank you for clapping for us, but we'll have preferred you give us some cash to say thank you. Racism in nursing is always, in healthcare generally, has always been there. So COVID just brush it up properly to say, yes, we're here. We're here to practice it now. Racism has always been there in nursing. Always. And it's going to remain. I'm not going to lie to you. It's going to remain. I decided to move away from nursing in 2014 because my first job, or my second job rather, in one of the hospitals I was working at then, I was when you qualify, you start as a band 5. So I did a couple of courses. I personally, I love studying. I believe when you study, you sort of educate yourself, make yourself more enlightened to what's going on in the world. I like studying. So I educated myself to the best of my ability. And then a post came up. We all applied for the post. I was given the post, plus other people. And the chief nurse decided to, not the chief nurse, the matron decided to pick on me and said, one, you're too young. Number two, you only qualify just a year and a half. So why did your manager decide to give you a band 6 post? Band 6 post is you're into the management now. So my reply was, yes, I am fit for the post. I work already as a band 6. You're not paying me for. I charge the theatre for you. I mentor students, medical students, nursing students, name them. We mentor them. I've done the mentorship course. I've done this course, that course, mentioned it all. She decided to pick a big fight with me. So that was my first point of, say, Roseline, I don't think you want to be a permanent staff. Because I, for one, I like to challenge people. If you're doing some behavior that is not acceptable, I don't care who you are as the management. I'll call you and say, can I have a word? And I'll tell you what you did to that person is wrong and you shouldn't have done it. You need to apologize. So because I am that kind of person, they didn't like it. They don't like NHS management don't like people that challenge them. But they need to be challenged because if we don't challenge them, the same attitude will continue from my generation to the generation of my children, which I don't want. We are all human beings. We've been to uni same way you've been to uni. We've done the same studies. So I decided to say, okay, if you don't want me to keep your band 6 post, I'll give it back to you. So I took them to employment tribunal. I won the case and then moved on to another hospital with the same post. So I was there for a while, then come racism again. Because Roseline being who she is, my mouth can't be kept shut. Sorry. So there was a particular course that we meant to go for, and we all went for the interview, and I came the best. And they gave me the post, and I went. So everybody become a bit bitter. You only started in the trust not long ago. Why should they be giving you this? Because the course is like it's a course that everybody want to do, and I said yeah because I qualified for I passed the interview. That's why they chose me to go for the course. Anyway, the phase passed, and they brought another manager, and she decided to be picking on me. So I said no. I don't belong to NHS as a permanent staff. I belong to NHS to look after my patient. So that's why I said I am going to become an agency nurse, just go to work, because I'm trained to look after patients. That is what I want to do. I don't want to get into politics. NHS is full of politics. I don't want to have any posts. I don't want to belong to any cliques. I just want to wake up. I know that I'm going to theatre to look after the patient that has been allocated to me. I finish, I leave the hospital, I come back home. I'm not thinking of the person that picked a fight with me today, the person that's going to report me to HR, the person that is going to write an incident form about me. I don't think about all that anymore. I just wake up. I'm going to look after my patient. Go in there, look after my patient. Anybody step on my toe, I say, which toe do you like? My little one or my big one? I give it to them. They step on it. As long as my patient is okay, I come back home. Secondly, I'm someone that love heart. So that's part of the reason why that made me want to be a nurse. I just love humanity. So I do films. Most of my films are channeled towards humanity. I don't do commercial films. I only do charity-related film, to say. So to give me the flexibility to have the time for my film and have time for my patients, separate the two. Because if you're NHS staff, you can't decide to leave work. And because we have a body we answer to called NMC, Nursing and Midwifery Council. So if you're meant to come to work, you don't come to work, they can report you to them. In as much as I'm not affiliated, or how should I put it in English? I'm not attached to any particular hospital. I can decide to say, I don't want to work this week, and then focus on my movie. And the next week I go back to work.